This is Ron Valdesari, Deputy Assistant Secretary for Health from the Department of Health and Human Services, and I'm here at the International AIDS meeting in Vienna with my friend and colleague, Dr. Carl Dieffenbach, who is the Director of the Division of AIDS in the National Institute of Allergy and Infectious Diseases, which is part of NIH. And Carl, it's great that you could join us. We have a few questions we'd like to ask you to share with the audience. Can you start by telling us what you mean by functional cure? We've heard that a lot at the meeting here.
So simply put, a functional cure is the ability to treat an HIV-positive individual with a substance such as a therapeutic vaccine or some other method of treatment that then allows the individual to stop taking heart therapy but maintain low or no viral load and also get to a place where they also are no longer able to transmit HIV.
Great. Thank you for clearing that up. Well, can you tell us, Carl, what other important research NIH has presented at the meeting this week?
So one of the absolutely key findings is actually being presented this afternoon as a late breaker, and it's the findings of a study called Camellia, which we co-sponsored with the ANRS. This study defines the standard of care for dually infected people, HIV, TB positive people, and defining when to start their TB therapy and when to start their HIV therapy. This really sets the standard for the world.
Excellent. And for the audience, ANRS
is the French National AIDS Research Organization.
Thank you for clearing that up. And then finally, as you know, last week the President Obama and Secretary Sebelius released the National HIV/AIDS Strategy in the United States, and we were all delighted about that. But now, of course, we have a great deal of work to do to implement it. Can you share with me some of your initial thoughts about how the strategy will affect the work of your division and your center and the other parts of NIH doing AIDS work?
Oh, my pleasure. First and foremost, this is a brand new day in the United States with the National AIDS Strategy. What the National AIDS Strategy does is define how to take the tools we have today and really start impacting the domestic AIDS epidemic. What we will be able to do at NIH based on the National AIDS Strategy is to really direct our research in a way that fills in the next steps that are required to take what we have today and push the ball over the goal line to accomplish the President's three major goals. Reduce incidence of HIV, provide enhanced care and treatment for HIV-infected individuals, and reduce health disparities for people living with AIDS.
Excellent. And I'm so glad you repeated the goals for the audience. We'd also like to tell you, if you want to read more about the strategy, please visit AIDS.gov and you can read in detail what the plans are and what the timeframes are. I want to thank Carl Dieffenbach. This is Ron Valdesari signing off from Vienna at the International AIDS meeting. Thank you.